In Unit 13, we will discuss medical abbreviations, acronyms, and mnemonics. The Joint Commission's Do Not Use list is also introduced. The appendix of your textbook contains a list of medical abbreviations and acronyms along with their meanings. The learning objective for Unit 13 is to list and define common medical abbreviations. An abbreviation is a shortened or contracted form of a medical term or phrase that is used in place of the actual term. An abbreviation uses a group of letters taken from the term. For example, GLUC is the abbreviation for glucose, and CAF is the abbreviation for catheter. An acronym is a specific type of abbreviation that uses the first letter of each word of a multi-word term to form a new word. The acronym for the World Health Organization is WHO, pronounced like the word who rather than stating the individual letters WHO. An initialism is a type of acronym that also uses the first letter of each word of a multi-word term to form a shortened version of the term in which each letter is pronounced individually. The term ICU, in which each letter is produced individually, is used to represent the intensive care unit. A list of medical abbreviations typically contains abbreviations, acronyms, and initialisms. Occasionally, symbols are used to represent medical terms. A partial list of common symbols appears on the slide. Please review the symbols and their meanings and commit them to memory. A mnemonic is a memory tool for helping you remember facts or large quantities of information in a certain order. Many mnemonics, especially those related to medical terminology, use acronyms to create a unique phrase to aid in memorization of the information. A common example of a mnemonic that is used to remember the carpal bones is so long to pinky, here comes the thumb. The first letter of each word of the mnemonic is used to represent each of the 8 carpal bones in order. The sequence moves from lateral to medial in the proximal row and then loops back from medial to lateral in the distal row. With the hand in anatomic position, the word so represents the scaphoid bone, which is near the thumb, moving medially toward the body. In the proximal row, which is closest to the forearm, the word long represents lunate, 2 represents the triquetrum, and pinky represents the pisiform and also indicates that the pisiform bone is near the pinky finger. Then, moving laterally away from the body in the distal row, which is closest to the hand, here represents the hamate, comes represents the capitate, V represents the trapezoid, and thumb represents the trapezium, and also indicates that the trapezium is near the thumb. Many medical terms and abbreviations can look alike, especially when handwritten, and sound alike. In an effort to improve patient safety, the Joint Commission on Accreditation of Healthcare Organizations, commonly known as the Joint Commission, or TJC, has issued a list of national patient safety goals that focus on problems in healthcare safety and how to solve them. The patient safety goals are related to correctly identifying patients, preventing infections, reducing errors in surgery, and using medications safely, among others. The Joint Commission has identified abbreviations, acronyms, symbols, and dose designations that can be dangerous, especially when ordering and handling medications in an official Do Not Use list. Please click on the link provided to view the official Do Not Use list. In summary, you have been introduced to some of the abbreviations, acronyms, symbols, and mnemonics related to medical terminology, as well as the Joint Commission's official Do Not Use list.